day, class, and welcome to Chapter 16, Medications and Electrical Therapy. The first part of this lecture will be talking about the different types of medications that are given to patients who suffer from some type of cardiac disease. So that will be the lecture for today. Treatment of arrhythmias can involve medications, electrical shock to the heart, or an electrical stimulus to pace the heart. Cardiac medications are used to treat arrhythmias or abnormalities in cardiac function. Other medications are used to treat other conditions or diseases but can have some sort of ECG effects. Antiarrhythmics is a type of medication. These medications are used to treat and or prevent any type of arrhythmias. They all can affect the action potential of a heart condition. There are four classes of antiarrhythmics. You have class 1, which is your sodium channel blockers, class 2, which are your beta blockers, class 3, which are your potassium channel blockers, and class 4, which is your calcium channel blockers. And as you can see, if you go back in chapter 2, every single one of these have some type of effect of your action potential. The first class we're going to talk about is, of course, class 1 of your antiarrhythmic medication. Class 1 is, of course, your sodium channel blockers. They are broken down into two different classes. Class 1 medications block the influx of sodium ions into the cardiac cell during depolarization. This results in decreased excitability of the cardiac cell and decreased myocardial contractibility. So this affects phase 0 of your action potential. And if you remember when we went through it, phase 0 is when you are forming your QRS complex. All right. There are three categories of a class 1 antiarrhythmic. You have class 1A. These medications include quetiapine and procainamide. They cause prolonged QT intervals as well as decreased cardiac contractibility. They can also cause hypotension also. Quetiapine is especially notorious for causing wide T waves. This medication is given orally. Procainamide can be given orally or intravenously. Most class 1A antiarrhythmic medicines can be used to treat supraventricular as well as ventricular arrhythmias. Both these medications have lost favor in current practice as other meds have proved safer and more therapeutic. Our next class of 1A antiarrhythmic medication is called class 1B. These medications include lidocaine and tocainamide, both of which have a local anesthetic effect. They are used for treatment of ventricular arrhythmias only. Remember, they only treat ventricular arrhythmias only. They suppress the ventricle's irritability and raise the fibrillatory threshold, making it less likely that the ventricles will fibrillate. Lidocaine is given intravenously, where tocainamide is given orally. The next class you have is called class 1C. 1C, these medications slow impulse conduction and are useful in treating SVTs and ventricular arrhythmias. These medications include phenylalanine and profenazone. They are prone to cause arrhythmias and are only used in life-threatening situations. Both of these are given orally. Our next class of medication is our class 2 medication, which is our beta blockers. Our beta blockers include medications that help to slow down the heart rate by blocking sympathetic nerve systems, beta receptors. Beta 1 receptors increase your heart rate, conductivity, and contractibility, whereas beta 2 receptors relax smooth muscles in the arteries and brachii. Beta blockers include medications such as propranolol and atenolol. Beta blockers slow the heart rate by blocking the sympathetic nervous system beta receptors. Which I said all this already. Sorry. Beta blockers are used to treat supraventricular tachyarrhythmias. They are also can depress phase 4 of the action potential, which is, if you remember, phase 4 is the resting phase of just before your PQRS forms. It's the resting stop. Beta blockers should be used with caution, especially with patients who have asthma or heart failure, due to the fact that it can be life-threatening because it does slow down the heart rate. Our next class is class 3, which is our potassium channel blockers. Our potassium channel blockers interfere with the movement of potassium ions into the cardiac cell during phase 3, which phase 3 is our T wave. Is the form of our T. So they can prolong the PR interval, the QRS, and our QT interval, being that our T wave will take a little longer time to develop. Class 3 medications can be used to treat supraventricular and or ventricular arrhythmias. Medications include aminodraone. Aminodraone is used to treat ventricular and supraventricular tachyarrhythmias. Aminodraone is given either orally or intravenously. Our next class is class 4, which is our last class of medication, and these are our calcium channel blockers. Our calcium channel blockers interfere with the influx of calcium into the cardiac cell during phase 1 and 2, which is also known as our early repolarization phase. That's our ST segment phase of the action potential, and can also slow down somewhat of your phase 4 of the action potential also. The use of these medications can prolong AV conduction, and contractibility will also decrease. Your PR interval is also prolonged with the use of this medication, and the heart rate slows. Calcium blockers are used for supraventricular arrhythmias. Medications include Vibramyl, diazepam, diazepam. Both can be given either orally or intravenously. Just a note or FYI, when the body gets an overdose of a calcium channel blocker, a supplement of calcium is given to correct the low level of calcium that your body is not given while on this certain type of medication. So as you can see on this action potential graph, how the different meds can affect each phase. So if you're taking a class 1, which is your sodium channel blockers, it kind of affects your phase 0, which is the forming of your QRS wave. If you have a class 2, it prolongs your phase 4, meaning you have a longer rest period before your P wave forms. If you have a class 3, which interferes with your potassium levels, it makes your phase 3 run slow, makes your phase 3 run slow, which is phase 3 is your T wave. And of course, class 4 medication can affect your ST segment or your early repolarization phase or your phase 1 and 2. So this graph is just basically a summary of the meds we just went over, where you have your class 1, which is your sodium channel blockers, your class 2, which is your beta blockers, your class 3, which is your potassium channel blockers, and phase 4, which is your calcium channel blockers. And it tells you mode of action, what example type of drug you have, and what kind of arrhythmia that it'll treat. All right, other types of antiarrhythmic medicines, they are atozine and digitalis. As you know, we have studied and heard digitalis pretty much all throughout this EKG chapter, whereas digitalis, if it's done correctly or if it's used correctly, it's usually used to treat heart failure and supraventricular arrhythmias. Atozine is used to treat SVTs or supraventricular tachycardias. You have your emergency cardiac medication, whereas your emergency cardiac medications are used during cardiac arrest or in an arrhythmic-induced life-threatening emergency. There's a list of emergency cardiac medications and how we use them or what they're used for. The first one we have is atropine, which is used to increase heart rate during bradycardias. If a person comes in with a very slow heart rate, almost non-existent, they'll give them atropine to help increase the heart rate. Then you have epinephrine, which causes a beta receptor stimulation. Basically what it does, it gives you a boost of energy, or gives your heart a boost charge. It's what epinephrine does. Because what it does, it restores the heartbeat and increase heart rate in cardiac arrest patients. This is used if someone is going in ASTOL, which means flatline, or if they're in VFib, or they have a pulseless VTAC, or pulseless electrical activity. They'll administer epinephrine. Then you have dopamine. Dopamine increases heart rate and renal blood flow. It is used in bradycardia. It is given as an infusion. The next type of medicine you have is aminotrone, which treats ventricular tachycardia, which treats ventricular fibrillation and ventricular tachycardia, as well as supraventricular tachycardias. Then you have, we just went over this one, aminotrone. Then you have sodium bicarbonates. Sodium bicarbonates are used to be a frontline medication that would be routinely given during any type of cardiac arrest, but its use has fallen out of favor in recent years due to research that has shown that it is potentially damaging if given when indicated by blood gas studies. So they don't use sodium bicarbonates as much anymore. As you can see on this graph, it gives you the different types of emergency medications that they use, what mode of action that they're used for, and the indication of when they would administer these types of medicine and for what type of arrhythmia is going on. And of course, our trusty drive-by is they always give oxygen. Oxygen is the first and foremost thing they'll give you before they even give you any of the medication first. They'll try you on an oxygen regimen and see if your heart rate increases therefore. If not, then they go to the medications. Other medications for EKG that has EKG effects or with EKG effects are, of course, the following medicines that are given for non-EKG related purpose, but they have effect on the heart rhythm or the heart rate. Of course, you have your diuretics. These medications are given to increase the urine output in patients with heart failure or renal disease, or if they have hypertension. That's why if a person has hypertension, they always have to maintain a certain amount of influx of water because they don't release water as much, they retain it, and that's how they get edema. Um, the EKG effects of a diuretic can have some type of ventricular arrhythmia or tachycardias. Then you have your bronchial dilators. These medications are used to dilate or narrow airways in patients with asthma or chronic lung disease. These medications are such as albuterol. Everybody knows albuterol. That is the first and foremost famous medication for anybody who has asthma. Then you have labetalol, probuterol, simantol, and formoterol. Ugh, these words. Sorry. But these are all different types of bronchodilators. Like I said, albuterol is the most popular one that everybody knows. Bronchodilators often cause a tachycardia, which is true, and sometimes it can increase their heart rate from anywhere from 140 to 150 in that range, and also can lead to a decrease in cardiac output or cardiac ischemia, and sometimes it can cause chest pains. That's why most asthmatics will guard their bronchodilator medicines with their life, because if somebody who has otherwise a healthy lungs and they take it just for the fun of it, they can actually cause themselves to go into a cardiac arrest. And some asthmatics can cause themselves to go into cardiac arrest if they abuse their bronchodilator. That's why they only get 2 puffs, and if those 2 puffs doesn't work, then they have to go to the ER to get an oxygen treatment. Then you have your hypertensive medicine. Yeah, antihypertensive medicines. These medicines are given to treat high blood pressure. They can include anywhere from a diuretic, a beta blocker, or a vasodilator. Beta blockers are used to treat hypertension by decreasing the workload of the heart and by dilating atrial walls. Vasodilators relax the walls of the arteries and or veins, and therefore lower the blood pressure. This can also decrease cardiac output and result in some type of tachycardia. The next example is you have your beta blockers, and then those are your examples of those 2 drugs. I'm sorry. All right. The next type of drug that can have some kind of EKG effect is, of course, your nitrates. Nitrates are medicines given to dilate the coronary arteries and improve coronary blood flow, thus reducing or eliminating chest pain. This is what they give patients who are suffering from MIs. They'll give them a nitrate, or a nitroglycerin pill, as it's called sometimes. And the main example of this is nitroglycerin tablets. So this is used to drop blood pressure and to help the patient relax and hopefully to open up arteries and airways so your heart can function again. Glaucoma medication. As we know, glaucoma medication are eye drops used to decrease the intra-auricular or eyeball pressure that is caused from glaucoma. Its EKG effect is it can cause you to have bradycardias. Erectile dysfunction medication. This medication can cause prolonged drop in blood pressure as well as cardiac ischemia, MI, tachycardias, especially if those medications are taken by patients who use prescription nitrates such as nitroglycerin for chest pains. Viagra is the most, well, Viagra was the most popular one, but now they have Cialis is now the new popular one that they have now. Tricyclic antidepressants or TCAs. TCAs are a toxic level. At toxic levels, this medication can cause bradycardias, including AV blocks, as well as sinus tachycardia, unstable ventricular arrhythmias, ASTOL, widened QRS, and prolonged PR and QT intervals. TCAs such as clobazamine are used to treat clinical depression. They are sometimes used for frequent suicidal attempts by overdosing. So most of the time, this is the drug that most people use to OD, to overdose or commit suicide with, is this type of antidepressant medicine. And of course, our favorite thing, illegal drugs such as cocaine, ecstasy. It's used to give the person a buzz. So the most common cause is EKG effect is it can cause you to have prolonged QT intervals. It can also cause you to have some tours de pointe, some tachycardias, some AV blocks, some myocardial ischemia, or even an MI, coronary artery spasm. That's why sometimes when a person who has OD, their body spazzes or it jerks. It's because their heart is going through a spaz. Then you have thrombolytics. Thrombolytics are used to dissolve the blood clot, causing a heart attack or stroke. They can result in bleeding that can increase heart rate. Thrombocytes are successful at aborting a stemming process. The elevated ST segment should return to normal or near normal when you take one of these. Then, of course, our old trusty dusty are anticoagulants, which, as we know, anticoagulants are anti-clotting medicine. It prevents clots in patients with some type of atrial fibrillation and any other disorder. The EKG effect it can sometimes cause the patient to have tachycardias if bleeding results, meaning if they don't monitor to see how thick or thin their blood is, it can cause their heart to go into tachycardia, especially if the blood is too thin. Excuse me, because it seems like it'll make it seem like the heart is not pumping out any blood because it's too thin. So it has to work extra harder to provide the body what it needs. Although all these medications or drugs are used for non-EKG related purposes, they have EKG effects. Always look at all the patient's medication to determine if any of them may be causing his or her rhythm or rare disturbances. Also consider that your patient's various medications may be interacting and causing rhythm and rate problems. That is the main reason why when a patient comes into the doctor's office, the first thing we always ask them is, what medicines are you currently taking? before we even step up and do a EKG, or even if we check blood pressure or anything. That is, we always have to get a patient's medication list just in case it's something that their medicine is causing them to maybe have a high blood pressure at that particular moment. Or if they're not on any or they're not on high blood pressure medicine or hypertension medicine, they might be on something else that's causing them to have a high blood pressure. So it's very important to get a patient's records